In 2017, there were over 400,000 reported diagnoses of sexually transmitted infections. That's according to gov.uk. One organisation aiming to tackle the stigma around sexual health is the Polarised Youth Service based at Spark, York.
We provide basic sexual health to young people from the ages of 16 to 24, and that includes testing, it includes condoms and just general advice and support around sexual health.
The project recently undertook a survey around sexual health and the results were worse than the group first thought.
So the Let's Talk Sex survey was based on the registration of our last Let's Talk Sex event and all of the services we provided within that. So it just asked basic details about people, why they were accessing the service and any additional needs that they might have.
So what were the results of the survey?
So it's quite interesting because we compared the results from our survey to the results that come out of the York Sexual Health Services based on the NHS. So it's quite different. So around 72% of the people that use the York Sexual Health Service identify as female, but 97% of our users identified as male. So it's a really big difference between them. Also, 13% of our users identified as LGBT, whereas only 3% of the users of the NHS service identified as LGBT. Other than that, we had some other stats about while only 3% of our users were identifying as female, over 50% of them were accessing for period products, which is something we're trying to tackle this year because we're partnering with the Luna Project, who are a period poverty charity based in York, and they're going to be providing comprehensive period poverty support and products for anyone that accesses our service this summer.
With 77% of STI diagnoses coming from those aged between 16 and 19, many young people aren't accessing available services.
Namely, there's a lot of stigma about it, it's embarrassing, it's awkward to talk about. There isn't that much information specifically for young people out there, really. It's more sort of medical, it's something that's quite formal, or they might feel that it's they don't want to tell their parents, they don't want to get in trouble, that kind of thing. So a lot of what we're doing is just trying to break down that stigma and make it something that's really accessible.
The Let's Talk Sex survey also discovered that teenage pregnancy in the area could also be a concern.
Highest rates of teenage pregnancy in York were within the Fishergate, Guildhall, Hull Road and Heworth area, which may be different by ward boundaries but create a huge combined area for teenage pregnancy. I think it's different for different groups of young people, and they face a lot of barriers between accessing health services. I think sexual health still has a lot of stigma around it, so testing in particular, that's one thing we're really trying this time around to reach out to people, use clever social media campaigns to try and reduce some of the stigma around sexual health and testing in particular. Often you're working through the day, it's quite hard to get into the integrated service, so it's quite nice to have something that you can access within non-clinical, informal, evening sort of environment.
Removing the stigma around sexual health is something that the Polarised Youth Service feels passionately about and something that they hope to tackle in order to give young people the courage to seek support. Caroline Davies, That's TV.